The second installment of this series will involve a discussion of the Early Hearing Detection and Intervention Program, otherwise known as EHDI. According to the American Academy of Pediatrics, there are approximately 12,000 infants born with hearing loss in the United States each year. Children with hearing loss who are identified early are likely to develop speech and language skills at the same rate as their normal hearing peers. Early identification is classified as the period between birth and 3 years of age. When hearing loss is not identified early, it can hinder the child's social skills and development of language. The EHDI program was created in order to identify newborns with hearing loss through the Universal Newborn Hearing Screening System. In the EHDI Act of 2010, the CDC stated that its aim was to provide technical assistance to agencies in the states to support an inclusive program and to conduct research that applies to newborn and infant hearing screenings, evaluation, and intervention procedures. The EHDI program works to create general protocols for managing data, quantifying the effectiveness of early intervention programs and their costs.
The EHDI program focuses on family-centered approaches to intervention and should be ingrained in all interactions health professionals have with families. When providing information and support to families, it is important for medical professionals to recognize and appropriately respond to families' emotional needs. Information and guidance must be provided by the professionals involved in early identification.
As a physician, providing the best care to infants and children with hearing loss is to be knowledgeable of the important components of hearing screening, diagnosis, and intervention, and the time-sensitive nature of these services. For those newborns who refer on their newborn hearing screening, EHDI has instilled its own 136 guidelines to ensure timely care and intervention. When there is a refer, they should be re-screened no later than 1 month of age. If the infant does not pass the re-screen, then an audiologic evaluation by a pediatric audiologist is administered. The evaluation should occur shortly after receiving a refer on the re-screen, as it may take multiple visits to get to a final diagnosis. For families who elect amplification, infants diagnosed with permanent hearing loss should be fit with amplification within 1 month of diagnosis. A diagnosis of hearing loss should be made by the time the child is 3 months of age. Once any degree of hearing loss is diagnosed in a child, a referral should be initiated to an early intervention program within 2 days of confirmation of hearing loss. The child should be enrolled in an early intervention program no later than 6 months of age. EHDI works to ensure that every child with hearing loss is identified and receives appropriate and timely intervention. Its other aims are to ensure newborn hearing screening results are communicated to parents and reported in a timely fashion according to state laws, regulations, and guidelines.